malaria is major for us. In terms of epidemiology, we do know that for every 10 people that will have fever, 9 is due to malaria. So the burden of disease is there. It is one of the few diseases that were mentioned by name in the MDG. The Millennium Development Goal number 6 says we should control diseases. But 3 diseases were called by name: AIDS, tuberculosis, and malaria. Malaria is important to us because we want to ensure that Nigeria becomes malaria free. You can imagine the savings in terms of lost opportunities occasioned by sick workers when they have malaria. If they no longer suffer from malaria, that is whole savings for everyone, both public and private sector, and the family. Then, for the government, the money we used to spend, the facilities we provided for treating malaria, for investigating malaria, could then be rechanneled to other areas that may have become important, like now increasingly hypertension, diabetes mellitus, the non-complicated ones are getting important now. Many of us are now enjoying the fruits of our labor, like the Western world, and so we're now entitled to them now. So what are we doing about malaria? A lot. It's a major issue. Right now in the ministry, we have a coordinated team that handles and coordinates what we are doing for the 3 diseases. We call them ATM. It doesn't mean anytime money. But if you look at the benefits, it could actually be anytime money, because we are talking of health, and health is wealth. But A stands for AIDS, T, tuberculosis, M, malaria. So we have the ATM team, and we try to coordinate so that we can use even what we've provided for one to drive home the other. And funding is a lot, but we still face challenges. Funding is a lot because the government budgets for malaria directly through all kinds of agencies, through Federal Ministry of Health, through the parastatals of the Federal Ministry of Health, like the National Primary Care Development Agency and so on. But more importantly too, we get support from the United Nations, for instance, through the Global Fund. Nigeria is both a donor and a recipient of Global Fund. There are very few countries that are enjoying that kind of status. Many countries are actually donors. They don't have malaria and tuberculosis, so they are not recipients. Some other countries are only recipients, particularly the poorer countries. But Nigeria is both a donor to the Global Fund and a recipient. So we also enjoy part of what we are contributing, but we are getting more than what we are contributing. So Global Fund funds these programs for us too, in addition to what we have. Then furthermore, the presidency, through the money recovered from the debt relief, and which the government says will be channeled into ensuring that we do well on the MDGs, is also supporting malaria. So we're doing a lot now. This year, the target is to distribute up to get to the 63 million mark for the long-acting insecticide-treated nets. 63 million. Yes, you may say that Nigeria population is over 150 million. So if we are still trying to get to the target of 63 million, we've not covered everyone. But then, it's a lot. Where we are facing problems is in operational cost, because some oversight, I won't call it error, it's oversight, that when it was costed, people did not remember that you needed to distribute this nets. It is not just procuring them. So we are going to do that. Now you talked about what is the net doing. You're actually stopping the vector, that is the mosquito, from making contact with the human being who is sleeping under it. Secondly, you're also using this net to kill this mosquito. So that net prevents physical contact, but it also kills the mosquito. And these new nets, the newer ones now, not the older ones, the newer ones we are using now, can actually last between 3 to 5 years, depending on the material. The ones made of polyester, which is closer to cotton, last 3 years. The one made of polyethylene, which is more plastic, lasts 5 years.